Hi friends, welcome to Easy Nurse where nursing education made easy. So Easy Nurse is presenting Lakshya 3.0 where we are going to discuss the exam oriented questions and important questions for your upcoming exams. So are you worried about your upcoming exams? Don't worry, we Easy Nurse team is here to help you. So today we are going to discuss nursing education or educational technology, that subject from the 5th semester. So let's discuss what is this important topic and important questions coming from this syllabus. So 5th semester students, be attentive, let's discuss, and also this will help you to get your better scores. So first we are going to discuss some MCQ questions. So let's start with some MCQ questions. So first one, the primary aim of nursing education is. So what is the primary aim of nursing education? So these are the options. So what will be the answer? It is to provide holistic patient care. So to give the holistic the care to your patient. That's why we are studying the aim of nursing education. So what is curriculum in nursing education means? So what is curriculum in nursing education? It is the planned and guided learning experiences. So it is already we are planning the curriculum. So what are the planning here? Planned and guided learning experiences. So that is what called a curriculum. So next question we are going to discuss is the best method for teaching psychomotor skills in nursing. So these are the options like lecture, demonstration, group discussion, seminar. So how the best, which of this the best method for teaching the psychomotor skills? It is demonstration. So demonstration, through demonstrating we can able to teach them the best way of psychomotor skills. So next is the process of measuring students' performance is known as. So how we will measure the students' performance? Teaching, evaluation, guidance or counseling. It is evaluation. So we will evaluate after conducting a class. We will conduct a test paper for the students. So why? Because we need to evaluate how well the knowledge is there. So that is the process of measuring students' performance is known as evaluation. So these are some MCQs that may come for your exam. So it's very important. So which teaching aid provides three-dimensional view of an object? So 3D image of an object, which will help, which an audiovisual aid will help? It is, the answer is, it's a model. So if you have a heart model, so we can able to study heart detailly through a 3D anatomical structure. So which teaching aid is helping that? That is model. So which domain of learning involves development of attitudes and values? So which domain will help you for the development of attitudes and values? It is affective domain. So that is the answer. So next question, in micro teaching the duration of lesson is usually, so in the micro teaching technique, so what is the duration here? It is, the answer is 5 to 10 minutes. So the teacher should present in the content should be presented in the 5 to 10 minutes. So that is what called micro teaching. So lesson plan is, so what is lesson plan? So it is a detailed plan prepared by the teacher for teaching. So before the teaching section, the teacher will prepare a detailed plan. So that is what called lesson plan. So it is a detailed plan prepared by the teacher for teaching. So these are some random MCQs that you need to study MCQs because you are getting that so many questions. So next is, which of the following is a non-projected audiovisual aid? So from this, identify which is the non-projected audiovisual aid: flashcard, PowerPoint slides, film strips and overhead projector. It is flashcard. So flashcard is a non-projected audiovisual aid. Which method of teaching promotes learning by doing? So learning by doing. So which method is proposing that, or which method helping in that? It is the demonstration. So demonstration where the demonstrator will demonstrate the skills. So it is learning by doing. So that is the method of teaching promotes learning by doing. It is demonstration. So definition of education. So let's discuss some other questions rather than MCQ. So first question we are going to discuss is definition of education. So what is education? It's both the act of teaching others knowledge and receiving any knowledge or guidance from others as part of their experience. Teaching the others knowledge and gaining the knowledge from others, that is what called education. So it's act of both learning and teaching. So it's act of teaching others the knowledge and receiving any knowledge or guidance from others as part of their experience. So it is both the acting of teaching and also learning. So that is education. Education is defined as where the act of learning and the act of instructing goes hand in hand. So where we are acting, we ourselves we are teaching, and we ourselves we are learning. So it has two actions. It usually takes place under the guidance or influence of an educator, teacher, elder, younger or experienced person. So the teacher will teach you in the class. So you'll gain a knowledge from the teacher. So that is what called education. So what are the principles of education? Principles of learner-centeredness. So it should be the teaching or the education should excuse me, it's based on the learner. So the child or the student who is studying. So it should be based on the learner. It is principle of activity, learning by doing, like demonstration. So it is easy for the student to understand, learning by doing. And principle of motivation. So you should have, as a teacher, you should motivate your children to, or motivate your students to get the gaining the knowledge. Principle of individual differences. Each student has each individuals. So they have individual differences. So consider each individual differences as a teacher. Principle of correlation. Connect one point to another point. So correlation should be there. Connection between the topics or content should be there. Known to, principle of known to unknown. So start teaching from the known lessons. Let the students some point they know. Start from the known to the unknown facts. So start from the known facts to the unknown facts while teaching. So principle of simple to complex. So from simple teaching, if you are teaching some content, from the simple point to complex point you should come. Also concrete to abstract, from the concrete points to abstract or abstract paragraphs. Theory to practice. So first teach them theory, then teach them the practical side. And also principle of continuity. So you should have a continuous. So from the day first to the next teaching, it should have a continuity. So these are the principles of education. So these also will come for a short essay or a long essay. So detailedly, if you want any explanation, you can download EasyNurse from the Play Store and App Store. So next we will discuss about relationship between philosophy and education. So what is the difference or relation between the philosophy and education? So philosophy, it is setting the ideals, principles, goals and standards. So philosophy will set the ideas, the principles, the goals and standard, where education work out of those values based on the reality and truth. So education is based on the reality and truth. So that's the difference or relationship here. It is a theory and speculative. So philosophy is theory and speculative, where education explains how to achieve the goals through means of educational efforts. So how to achieve the goal. So that will teach by the education. So philosophy, it is a contemplative side here. It is a practice discipline. So philosophy is a contemplative side, where education is a practice discipline. It deals with abstract ideas and ends into the situation, where education is an active side. It's a dynamic process. So philosophy is an art, where education is a science. And philosophy formulates the methods, where it deals with the education deals with the process of method. Which philosophy formulating the method, but the process of dealing with the methods is teaching through the education. So this is the relation between philosophy and education. So it's also very important for the exam. So further explanation you can go through EasyNurse. So next we will see traditional philosophies of education. So what are the traditional philosophies? Naturalism, idealism, pragmatism and realism. So these are the four traditional philosophies of education. Now coming to the modern contemporary theory of education, it is existentialism, parallelism, essentialism, progressivism and social reconstructivism. So these are the theories, traditional modern theories. So for further explanations, you can go through EasyNurse, where you will get all the theories, detailed explanations. So next important topic we are going to discuss is teaching and learning process. So what is teaching and learning process? Teaching is the stimulation, guidance, direction and encouragement of learning. So teaching is the process, or teacher is the processor who give the motivation, guidance, direction in the case of learning. So it's a system of actions intended to induce learning and interpersonal influence to change the behavior potential of another person. So it's a capacity of a teacher to influence the behavior of other person to change into adaptive behavior. So that is what called teaching. Learning So what will be the definition of learning? It is the process of modification of behavior and habit formation through experiences and conditioning. So we are learning something. So we will modify our behavior based on that. So that is what called learning. So it's the process of modification of behavior and habit formation through experiences and conditioning. So this is the definition of teaching and learning. So next question we are going to discuss is maxims of teaching. So it's also very important. So what are the maxims of teaching here? Teaching is an art and science. So basically teaching is also art and also a science. It requires two things, knowledge and process of teaching. So the teacher needs knowledge and the process of teaching. So what are the maxims here? Simple to complex. So as a teacher, you need to teach your student from the simple point to the complex point. So simple to complex, it will help the students to easily understand. Known to unknown factors. So from the known point to unknown, that student already knows something about. If you are teaching anatomy, if they know something about that, then start with that point into the unknown facts. Concrete to abstract, from the simple topics to the abstract topics. Psychological to logical, from the psychological it should go to the logical. Introduction to deduction, start with introduction, end with the deduction. Empirical to rational. Whole to parts, from the wholes to it should be coming into the parts. So these are the main maxims of teaching. So now let's discuss what are the benefits of maxims of teaching. Simplifying the process of teaching. So the entire process of teaching, this through maxims, we are following in the maxims, then we can simplify the process of teaching. Joyful teaching and learning environment. So the environment will be joyful and happiness. Purposeful teaching. So the teaching will be purposeful. So the purpose will be helping the students. To create creativity among students. So it will help you to, like, the students will think more. It will help you have that students will have a creative thinking. To analyze and synthesize the students. So we can evaluate the students based on this maxims of teaching. So these are the benefits of maxims of teaching. So next question we are going to discuss is, that is a long essay question, demonstrated. So what is demonstrated? The teacher shows students how to perform tasks or apply concepts through demonstrations and examples. So the teacher who is demonstrating some topic or demonstrating some skills, that is what called demonstrated. So that person is known as demonstrator. What are the characteristics? Use practical examples, models and visual aids. They'll use practical, like a bed making. So they'll first teach you the theory, then they'll demonstrate you how to do the bed making. So that is using practical examples, models and visual aids. Focus on showing rather than just telling. So rather than speaking, they will show through their actions. So like a BP measurement. So they'll rather teaching you by the theories, they'll explain it to you through the practical way. So encourages observation and also hands-on practice. So what are the advantages of demonstrator? Makes abstract concept more concrete. So the abstract concept, we can make it into simpler concrete forms. Help students to understand through verbalization, visualization and practice. So through visualization they can observe, and through practice they can help to improve their skills. So that is why these are the advantages of demonstrator. Now coming to the next is disadvantages. May not address individual learning style effectively. So the 60 students is there in the class. So 60 have different capabilities. So it may not address individual learning style. Requires significant preparation and resources. So this is the advantages and disadvantages of demonstrator. You can expect this as a 10 marker or a 15 marker long essay. So this is also very important. Now let's discuss about learner. So who is learner here? Learner is an individual who engages in the process of acquiring knowledge. So the person who is engaging in the activities to get the knowledge, skills, attitudes or competencies through various methods and experiences. So through their methods and experiences, the person who is acquiring a new knowledge or getting a new knowledge, that is what called learner. So it's an individual who engages in the process of acquiring knowledge, skills, attitudes and competencies through various methods and experiences. Learners can be students in an educational setting, participants in a training program, anyone involved in self-directed learning. So if I am reading something, so that is I am gaining some knowledge. If I am teaching, the students is listening, that is also gaining a knowledge. So this is a learner. So the person who is gaining the knowledge. So next we are going to discuss about curriculum. So what is curriculum? It's a structured set of educational experiences and learning objectives designed to guide the instruction and assessment. So through curriculum we can able to identify what all the syllabus they need to cover. So what are the set of things they need to cover. So it is a set of educational experiences and learning objectives designed to guide in the teaching process. So it outlines the students are accepted to learn, the content to be covered, and the methods used to achieve the educational goal. So it have the expected, what all the things the students to learn, how the students to learn, what are the content they need to cover through this. So that is curriculum. So what is curriculum design? So it involves creating a structured framework that outlines the educational content. So we are creating a structured outline for the educational content, objectives and methods for teaching and learning. So it ensures educational goals are met through coherent plan of instruction. So before starting the syllabus, before starting the studies, we will have a curriculum. So we'll plan what all the things we need to teach, what all the things to be covered. So that will help the teacher as well as the students to gain more knowledge and save their time. So this is curriculum and curriculum design. Now let's discuss about what are the types of curriculum: formal, informal, hidden, null, spiral, integrated, project-based and competency-based. So further explanation of each of this curriculum you can go through EasyNurse, and you can download EasyNurse from Play Store and App Store, where we have already explained about this. You can see the videos as well as the notes. So next we will discuss about the next important topic, that is course plan. So what is course plan? It's a comprehensive overview of what will be taught throughout an entire course or semester. So the entire semester or entire course, what we need to teach them. So that is what called course plan. So it's an overview of what will be taught throughout the whole semester. So that is course plan. So what are the principles? Define course objectives. So we need to define what is the course objective. Determining the course content. So we need to see first semester what all the subjects will come. So what that we need to see. Structure of the course, schedule and timing. So how the schedules and what is the timing needed. Assessment method, resources and materials, flexibility. So these are the principles of course plan. Next question we will see about unit plan. So what is unit plan? It's a detailed plan for specific segment or unit within a course. So within a subject there will be chapters or units. So that is, we are detailedly planning how to finish one chapter, how to teach one chapter. So what are the time needs, what all the resources need. So that is what called unit plan. It's a detailed plan of specific segment or unit within a course. So what are the principles? Define the unit objective should be defined. Organize the content. Based on that, organize the content. Develop instructional activities. Plan assessment. Include differentiation. Allocate time. Identify the resources. So these are the principles of unit plan. Now coming to the next question or next important topic that you need to study is lesson plan. So what is lesson plan? So everybody will write the lesson plans. Nowadays you will write lesson plans. After that you will present the health education. So a detailed plan of individual class or a section or a lesson. So it is particularly based on one content. So it is an individual class, section or lesson. So what are the principles of lesson plan? Set lesson objectives. Plan the instructional activities. Prepare materials and resources, include assessment, structure the lesson, incorporate differentiation, reflect and adapt. So these are the principles. So if you want further explanation about unit plan, lesson plan, curriculum design, you can directly go to the EasyNurse, where you will get all the videos or expanded notes for each of this. So now let's discuss about the next question, that is classroom teaching. So what is classroom teaching? It's a process refers to the process of delivering instruction and facilitating learning within structured educational environment, typically a classroom. So it is a classroom teaching. So typically it is structured for the classroom. So it's a process of delivering the instruction or facilitation learning through structured educational environment. So in the classroom. So it involves teacher guiding the students through lessons, activities and discussions to impart knowledge, develop skills and encourage critical thinking. Effective classroom teaching combines various instructional methods and strategies to cater diverse learning styles and needs, aiming for foster students' engagement and activities. So basically you are a student, you will study in a classroom, so you are familiar with what is classroom teaching. The teacher will teach you in a structured environment, that is what called classroom teaching. So that's the definition. So what are the principles we need to focus here? Active engagement. So here sometimes what happens, the teacher is active and the students will be passive, so the active engagement of both the sides should be present, and clear objectives should be defined. Adaptability should be there based on excuse me. Based on the situation, the classroom setting should be changed. Adaptability should be there. Inclusivity should be there. Assessment and feedback should be taken. Also, student-centered learning. So the teacher is basically focusing on the students. So student-centered learning. And also, varied instructional strategies should have motivation, classroom management, reflection, and improvement. So these are the principles of classroom teaching. Next, we will discuss about lecture method. So what is lecture method? It is also a traditional teaching approach where the instructor verbally delivers the information or lesson to a group of students. So through words, the teacher will convey the information to a group of students. That is what called lecture method. It involves the teacher presenting the fact, concept or explanation, usually without much interaction with the students during the lecture. So here the teacher will stand in front of you, he will teach you the things where the teacher will be active and the students will not be active. So there is much less interaction between the student and the teacher. So that is what called lecture method. So what are the process here? One, preparation. So we need to do the objective setting, content selection should be done, instructional materials like AV8 should be prepared, understanding the audience. So what the audience is needed or what the students is needed, we need to understand. So this is preparation. Coming to the introduction, sharing the objectives, opening a statement, link to previous knowledge. So try to link to the previous knowledge, then the students will able to explain. We can able to explain and the students will easy to understand. Next is presentation, organizing delivery, how you are going to present your content, uses of aids, like which AV aids you are going to use, and the engagement with the students and the teacher. So clarification, clarify content. So after that presentation, you need to clarify any doubt or content they have, and conclusion. So after that you need to do the follow-up, like after that like conducting an exam or conducting a questionnaire. So this is the lecture method and its process. Now we will see what is the advantage of lecture method. Peer teaching. So we can able to have a connection with the students. So peer teaching will be there. Group projects will be done through lecture method. Demonstration is doing. We can do demonstrations here. Discussion methods also will come. Role playing and simulation. Efficient delivery of information. So this will give efficient delivery of information or ideas to the students. So what are the disadvantages? Limited feedback, because the interaction is much less to compare to the students. So that's why limitations will be there in the feedback. Passive learning. So the teacher is active and the student is passive. Information overload may happen. So if the teacher is continuously teaching, limited critical thinking, one-way communication, less practical application. So this is the advantages and disadvantages of lecture method. So next important topic that we are going to discuss is micro teaching. So what is micro teaching? It's a teacher training technique. So it is a teacher training technique, the technique given to the teachers, teacher technique designed to give educators an opportunity to improve their teaching skills by practicing them in a controlled environment. It involves a short lesson, typically 5 to 10 minutes. So within 5 to 10 minutes, the teachers will deliver a content or a topic. So to a small group of students or peers, followed by feedback and reflection. Micro teaching allows the teachers to focus on the specific teaching strategies, experiment with different methods, and refine their technique in low pressure settings. So it is basically 5 to 10 minutes the teacher need to take a class or deliver a content. So that is what called micro teaching. So what are the features? Short duration, typically 5 to 10 minutes per session, and feedback. Immediate feedback will be given from the observers or peer to guide the environment. Like the students is sitting and after the classes directly will get the feedback. It will help the teacher for improvement. Next is reflection. Teacher can reflect their own performance and make adjustment in the future sessions. Next is focused objectives. So aimed at developing specific teaching skills like questioning and explanation. So we can use that. It will help the teacher to improve their skills. So next we will discuss about skill lab simulation. So what is skill lab simulation? In nursing education, a skill lab simulation refers to controlled practice-oriented environment. So it is a controlled practice-oriented environment where nursing students can develop and refine their clinical skills. So as a nursing student, we need to have a clinical skills. Clinical practice is necessary. So these simulations often involve realistic scenarios and mannequins that mimic real life medical situation. So it is having a real life situation, so where they can improve their skills. So the goal is to provide hands-on experience in safe setting, allowing students to practice the procedures, make decisions, manage patient care without risk associated with the real patient. So it is not the real patient they are treating, it is the real scenario or incidents we are creating for them to practice. So that is safety ensures, we are ensuring both the safety of the students as well as the patient. So that is skill lab simulation. Next is symposium. So what is symposium? In nursing education, a symposium is formal gathering or a meeting where expert in the field presents information, research or insight on specific topics. So a group of experts will come, they'll present their topics or knowledge. So that is what called a symposium. It's a formal gathering or meeting. So these events typically involve multiple speakers or the panelists who discuss their specialized area, followed by question answer section or open discussion. So they'll discuss something. After that, we can, as a listener, we can also ask them questions or we will discuss about the topic. So that is what called symposium. Yes, for further explanation of each of the topics, you can download ECNUS where we have already explained it. So you can able to see the further explanation. Next, we will discuss about panel discussion. So what it is? It's a discussion in nursing structured format in which group of experts or professionals, typically 3 to 6 panelists, engage in a discussion on specific nursing related topics. So some 3 to 6 people who are very experienced in their profession. So they'll come and discuss about some topic in the nursing. So that is what called panel discussion. So next we are going to discuss about seminar. So what is seminar? In nursing education, seminar is a structured interactive educational section where students or faculty engage in in-depth discussion on specific topic or issue related to nursing practice, theory or research. So the teachers and the students will discuss about a particular topic. So in-depth detailedly they'll discuss. So that is what called seminar. So seminars will be maybe conducted for whole day, 2 days or 1 week. We can conduct based on the discussions. Next is clinical teaching. It's a process of educating students in real or stimulated healthcare environment, focusing on the application of theory to practice and the development of clinical skills under supervision. So the teachers, after the teaching you theory in the classroom, they'll take you to the hospital to give the skills demonstration. So by that we can do the practical side. So that is clinical teaching. So what are the purpose? It helps the students to apply theoretical knowledge into real life situation or the real life patient care. It develops clinical skills, critical thinking and decision making abilities. So the clinical practice, the skills will improve, their critical thinking abilities will improve while they will work in a hospital. It fosters professional attitudes, confidence and communication skills in nursing practice. It prepares the student to provide safe, effective and holistic care to the patient effectively. So these are the purposes of using clinical teaching. So from the theory, we will do the practice, then we can able to improve our confidence and skills, and also we can give the patient the holistic care. So next is bedside clinic. So what is bedside clinic? It's a process in which clinical teacher and a group of learners see the patient. So the teacher and the group of students will go and see the patient, elicits or verify physical signs, discuss professional diagnosis, diagnostic and therapeutic options in the clinical setting. So that is what called bedside clinic. So we will as a teacher and the students will go to the patient side, they will see the vital signs, they will check the vital signs, they will discuss about the diagnosis and the treatment and other diagnostic measures. So that is what called bedside clinic by Gaberson. So next question we are going to discuss is case study. So what is case study? It's a nursing case study is an in-depth examination of patient's health status, care needs and nursing intervention. So we are in-depth or detailedly we are learning or studying about the patient health status, care needs and nursing intervention. That is what called case study. So as a nursing student, while you are going for the posting, so in the practicals in hospital, you need to collect the patient data, you need to do the case study. What is the disease condition, you need to study on that particularly. So that is case study. So what is nursing rounds? So it's a teaching method that helps the students to determine the objectives, select the patient and plan the care needed to improve their knowledge, ability to share their ideas, discuss with various nursing problems. So it is a teaching method, the teacher nursing round will help the students to determine the objectives, what are the goals to be done, what are the how to select the patient, what are the plan that is needed for the care of that patient. So this is nursing round. Now let's discuss about ethics. So what is ethics? So ethic is the science of ideal human character or the science of moral duty. So it is the ideal human character. So it's defined as the science of ideal human character or the science of moral duty by Roosevelt Kidder. So what are the code of ethics? As a nursing student, you should follow autonomy, justice, beneficence and maleficence. So as a nurse or as a nursing student, you should follow this code of ethics: autonomy, justice, beneficence and maleficence. So you can see further explanation in easiness application. So what is EBP? Evidence-based practice. So what it is? It's something that furnishes or proof or testimony or something which is legally proved. Evidence-based practice. From the evidence, it is already proved. So that we are continuing. So that is what called evidence-based practice. So what are the steps here? Ask. First you need to ask, analyze, acquire, appraise, apply and audit. So these are the audit. So these are the steps that's needed in evidence-based practice: ask, analyze, acquire, appraise, apply and audit. So further explanation you can go through easiness. So next important topic or important question that definitely come for your exam is guidance. So what is guidance? It's the process of dynamic interpersonal relationship. So it's the process of dynamic interpersonal relationship designed to influence the attitude and subsequent behavior of a person. So it is guidance. We are guiding one person. It will subsequently affect the behavior of person. So it's a dynamic interpersonal relationship designed to influence the attitude and the subsequent behavior of another person. So it's defined by the good. So what is counseling? So exactly opposite, guidance and counseling. So what is counseling? It's a method that helps the client to use problem solving process to recognize and manage the facilities, interpersonal relationship among client, family and healthcare team. So we are giving the counseling. So we are giving the problem solving techniques to the client or the family. So that is what called counseling. So guidance, we are helping them to change their behavior, where we are counseling, we are giving them the problem solving process to recognize and manage the stress. So what are the principles of guidance and counseling? So guidance and counseling are unique to an individual. So it's based on the individual. So it is very unique to every individual. It is concerned with holistic development of the individual. So holistically it should have to help the individual for their development. It's always goal oriented. Guidance and counseling will be always goal oriented. So if you are guiding them to take a course after completion of their PUC or the +2, so you'll guide them to take some courses. So that is what called, it is also a goal oriented. So counseling also, it's a problem solving. So that is goal oriented. It relates to the individual behavior process. It is based on the individual behavior process. It's a professional service. So guidance and counseling as professional services, focusing on the characteristics of growth and developmental stage, targeting all those who need help. So whom we are giving the guidance and counseling, the people who need the help. So it is continuous and sequential educational process. It's a continuous and orderly process. Should have a reliable data. It should have a flexible approach. So these are the principles of guidance and counseling. So guidance and counseling is very, very important. You need to study this because it's a 100% this question may come for your exam. So next we will see difference between guidance and counseling. So what is the difference? Guidance is a continuous process, comprehensive and broader than counseling, where counseling is not necessarily a continuous process. It is an integral part of guidance. All counseling is guidance. So guidance is where it's a continuous process, where counseling is not a continuous process. Guidance is guiding act involve giving advice and direction. So as a guidance, we are giving advice and direction. But counseling is a psychological specialty. It does not involve giving advice or direction. So we are not giving advice or direction. We are giving the counseling. It's a psychological process. Guidance is generally education or career related. So guidance mainly is coming to the career or education related, where counseling is mostly based on the personal and social issues. So in guidance, it focusing on finding a solution, where counseling focus is not on the solution but understanding the problem. So it's not the solution but understanding what is the problem. Guidance can be given both one-to-one basic, also it is in the group. Counseling is usually done one-to-one. So guidance we can give to a group of people or individually also we can give, but counseling will give only one-to-one person. So for the counselor will be there and the counselee will be there. So this is the difference between guidance and counseling. Now let's discuss about the counseling process. So what are the process here? Step 1, initial disclosure and relationship building. So we'll initially introduce ourselves and relation building. Step 2, in-depth exploration and problem assessment. So in-depth we will talk to them. We'll identify what is the problem. Step 3, commitment to action and goal setting. So what actions we need to solve that problem. So we'll set the goals. Step 4, counseling intervention. Step 5, evaluation, termination or referral. So this is the counseling process, the 5 steps. So evaluation and assessment. So next important topic we are going to discuss is evaluation and assessment. So what is assessment? The process of collecting, measuring and analyzing information or data to understand the situation, condition or individual performance. So we are collecting the data. So that is what called assessment, to understand the other person, to understand the student's performance. So that is what called assessment. So what is evaluation? It is a process of making judgment or decisions that is based on the assessment data to determine the effectiveness, value and quality of something. So we'll see what is the effectiveness or what is we are making a judgment or decision in evaluation. So assessment and evaluation. So this is the definition of assessment and evaluation. Now we will discuss about another important topic, that is essay type question. So what is essay type question? Open-ended questions requiring detailed structured response to form an essay. So it's a open-ended questions. There is no question mark. It where we need to give the detailed explanation or for a structured explanation for a question. So what are the features? Requires critical thinking, organization and expression. Students must construct arguments and synthesize the information. So the purpose is to assess the students' in-depth knowledge and to ability to articulate the idea, critical analysis skills. So that is essay type question, long essay and short essay, where we need to write what are the expressions, what are the knowledge. It will assess how much knowledge about that particular topic the student is having. Next is short answer question. It's a questioning requiring brief specific response. So usually few sentence or a short paragraph where we need the exact answer within a 2 sentence or a short paragraph. So features, it's focusing on recalling the factual information, the correct information if the student is able to recall, or explaining the concept concisely, requires precise answers. So its purpose to assess understanding the key concept and facts. So this is short answer question. Coming to the MCQs, multiple choice question. It's a questions with a stem followed by several answer options. So it's a question with several answer option where only one answer is correct. So can assess a wide range of content quickly. So we can able to understand through this 4 options, we can able to identify the students wide range of contents. Also provide clear right or wrong answers. So it is to text a factual recall, comprehension and sometimes application of knowledge. So there are multiple options will be there. The only one right answer will be there in the MCQs. Next, we are going to discuss about audiovisual aids or communication media. So what is this? Audiovisual aids are a sensory objects or visual that help the student to learn by initiating, stimulating and reinforcing learning. So it's any technology that may be used to make the learning experience more clear, realistic, dynamic and as an audiovisual aid. So this is the definition of audiovisual aids. So what are the types of audiovisual? It is mainly projected and non-projected audiovisual aids. So what are the projected? Overhead projector, slide projector, film strips, LCD, epidoscope, opaque projector, multimedia projector, computer or smartboard, television or video, PowerPoint slides. So these are the examples of projected aids, where it is non-projected aids are charts, models, poster, flashcard, photographs, blackboard, bulletin board, flannel board, specimens and real objects. So we have explained all these projected and non-projected aids with their purposes, how to make that, what are the advantages and disadvantages in our ECNURS application. So you can go through ECNURS and you will get further details for each of this. So next we will discuss about ICT. So what is ICT? Information and Communication Technology. So it is the use of computing and telecommunication technology, use of computer and the telecommunication technology systems and tools to facilitate where information is created, collected, processed, transmitted and stored. So we will use technology to collect the information, to process it, to store the information. That is what called information and communication technology. So what are the objectives of ICT in education? So to make teaching and learning more effective. So we can use this to excuse me, we can use this to make teaching and learning more effective. To provide easy access to information. So in computer we save the data. We can easily retrieve that data. To develop digital literacy skills. To promote self-directed learning. To enhance communication and collaboration. To support educational planning and management. Also to reduce digital divide in education. So these are the objectives of information and communication technology in education. So what are the benefits of ICT? Enhances quality of education. So it will improve the quality of education. Makes learning interactive and engaging. Provide access to vast information resource. So through internet we can download or we can see so many information at a time. So if you have a book, only book will give you a small topics or content, where the internet will give you more topics. So promote distant and online learning. Improves communication and collaboration. Saves time and increases the efficiency. Support creative and critical thinking. Facilitate effective record keeping and management. So the data we are storing in internet or the computer, we can use that for further. So management will be easy. Encourages lifelong learning. Bridges geographical and cultural gaps. So these are the benefits of ICT. Now let's discuss about another important question, that is latest approaches to learning. So what are the latest approaches? Experimental learning, like learning through direct experience and active participation, learning by doing. Reflective learning, learning by thinking about and analyzing one's own experience. So we are reflecting our own experience, that is reflective learning. Scenario based learning, learning through real life situations and problems based scenarios based on the real life situation. Simulation based learning, learning through imitation of real world process and clinical situation. So we are imitating the real world process in a clinical situation. Blended learning, learning that combines the traditional classroom teaching with online learning methods. So that is blended learning. So nowadays everywhere there is a blended learning, where traditional classroom teaching also will be there, online teaching also will be there. So these are the latest approaches to learning. Now let's discuss about the essential qualities of a teacher. So what are the essential qualities of a teacher? Good communication skills. So the teacher should have a proper good communication skills. Patience and understanding should be there. So the teacher should have patience and to understand each of their students. Deep subject knowledge. So the teacher who is teaching the particular subject should have deep subject knowledge. Creativity in teaching should be there. Fairness and impartiality should be there. So each teacher should be fair to everybody and impartiality should be there. Empathy and compassion should be there. Good sense of humor, strong organizational skills, adaptability and flexibility, commitment to continuous learning. So these are the essential qualities of a teacher. Yes. So in this section, we had discussed about the nursing education or educational technology, the important topics and questions. I hope everyone understood. So for further explanation of each of this topic, you can directly go through Easy Nurse, where you will get all the videos as well as short and detailed notes about this particular subject. So we will meet in the next section with another interesting topic. Till then, keep learning, keep growing with Easy Nurse, where nursing education made easy. Thank you.